And our speaker is Brenda Swihart. She is the stroke program manager here at North Kansas City Hospital, and I am very excited to have her. Brenda?
Thank you, Shanna, and welcome everyone. I always love giving talks about stroke. I'm very passionate about it, and May is Stroke Awareness Month, so it's another good reason to just get me talking about something I'm very passionate about. I'm going to start off with some stroke statistics in the United States. Stroke ranks as the number 5 death among all causes. It amounts to approximately 142,000 per year. So that equates to a stroke occurring every 40 seconds. And each year, approximately 795,000 Americans will experience a new or recurrent stroke, with about 610,000 of those being first-time strokes for patients. It is an estimated cost of $46 billion per year. And the most sobering fact about the strokes is that it is the number 1 cause of serious long-term disability. Let me go through a little bit of facts about women and strokes. So stroke does kill more than twice as many women every year as breast cancer, and 1 in 5 women will have a stroke. More women do die from a stroke than men, and that is because women have a higher life expectancy. They also have a greater disability after their stroke than men. We are seeing women at a younger age, between 45 to 54, experiencing a first-time stroke, mainly due to the increased risk factors and lack of prevention knowledge. So that's why I feel very passionate about getting out how we can prevent strokes and what risk factors are included or involved in stroke. There is a breakdown that is more prevalent by race. African Americans, American Indians, and Alaskan Natives are at the highest risk group for having a stroke. And then that stroke risk is doubled for African Americans, mainly because they have a very high incidence of high blood pressure and may not be aware of it. They are also twice as likely to die from their stroke than Caucasians and suffer more extensive physical impairment. And Hispanics are more likely to suffer a stroke at a younger age. Again, we've gone over the cost, but up to 80% of all strokes are preventable through risk factor management. And we have about 6,400,000 stroke survivors in the United States. So a lot of people out there living with strokes and learning how to deal with those. This data is very old, but is a very good graphic to show by state what the most common cause of death was, other than heart disease and cancer. And you can see for Missouri, it is stroke. I'm going to talk a little bit, not a lot, but a little bit about the types of strokes that occur. There are 2 different types. The majority, 85%, are ischemic strokes, and that's where a clot forms and blocks the blood flow to part of the brain. The other kind is hemorrhagic stroke, which accounts for about 15%, and that's where a blood vessel that is weakened ruptures and causes bleeding in or around the brain. So I talked a little bit about the ischemic stroke occurs when a clot builds up, but often what precedes that is a fatty plaque deposit in the artery, and then platelets will adhere to that plaque and form a clot, which then will occlude the artery and cut off the blood flow and circulation to those brain cells. We talked about the hemorrhagic stroke, that where the weakened vessel ruptures and bleeds into the tissue, and it can be severe enough to where it will cause those brain cells to die because of the compression. A third, it's not a stroke, but often referred to as a mini stroke, but again, is not something to be taken lightly. It is called a TIA, or transient ischemic attack, and patients will have stroke-like symptoms with this TIA, but the blockage, if there's blockage, it is temporary and usually doesn't cause any permanent damage to the brain. The symptoms are also temporary and only last anywhere from 30 minutes to a few hours, but they can mimic a stroke exactly, so it's nothing to take lightly. We would rather see you in the ER, and we can start taking care of that before that becomes a greater issue, because approximately 15% of those will go on and have a major stroke post TIA. And time is a factor when we're dealing with a stroke. Recognizing the symptoms, getting to the hospital in a timely manner. There are a couple things we can do in patients who are having what the majority of the type of strokes are, the ischemic stroke. We have a medication that's called Alteplase, and we can give that through the IV, and it busts up the clot and will lessen the chance of the disability that you will have post-stroke. It has to be given, though, within 4.5 hours of symptom onset, so time is of the essence, and we always want you to call 911. Do not drive yourself to the hospital. I have seen people get in accidents while they're having a stroke, and that's just not something we want to happen, because then it makes it more difficult for us to know, well, did they have the accident and or did they have the stroke first? Which came first? And we have to treat both of those things. Another type of treatment is, along with the IV Alteplase that we can give, there is a surgical procedure or technique called a mechanical thrombectomy, that they go in and physically remove the clot from the blocked artery. And this is what it looks like. This is what the device looks like. And they just go in through an artery and thread this up on angiogram and look at it and find the clot and pull it out. And both of those combined, I have seen patients even with just the clot busting medication and not even requiring the thrombectomy. I've seen them in the ER improve back to their baseline, and also and others, it just varies on the size of the stroke, but I do see patients improve with this, and the likelihood of their disability lessens with the treatments that we have available now. For hemorrhagic strokes, or those brain bleeds, if they're caused by an aneurysm, we can go in and they have two different techniques. They have clipping, which is the image on the right side where they just clip off that aneurysm with a surgical clip, or on the right they do this procedure called coiling, and they have this wire that they just keep feeding into that aneurysm, and it coils around and around and around until it securely closes off that aneurysm and there's no leaking from it. And that again minimizes the disability. So some stroke recognition and risk factors. I've broken them out by what we can modify and what we can't modify. So we can't change our age, we can't change our gender or our family history or our race. If we've had a prior TIA or stroke, and even heart disease, we cannot change that. Another one is migraines with aura, which means you have symptoms and you can tell. A lot of times it's flashing lights to tell that a migraine's coming on. Those we can't change. So we're going to focus on those that we can modify. Highlighted in bold are the major risk factors: hypertension, smoking, diabetes, high cholesterol, and obesity. And one that I didn't but probably should have highlighted is the atrial fibrillation, because that also is a risk factor in and of itself for having a stroke. At least half of Americans have at least 3 of these risk factors and sometimes are not aware of it. The risk of strokes: more than 50% of Americans, like I said, do not know that they are at risk. They do not know their risk factors, so therefore they don't know they're at risk. 80% of these can be prevented. 77% of those first-time stroke patients have high blood pressure, and often, as I've already discussed, at 50%, it's undetected prior to them coming to the hospital. 15% of those are preceded by those mini strokes, the TIA. Like I said, atrial fibrillation increases your risk of a stroke 5 times. The smoking increases your risk 2 to 4 times. Diabetes 1.5 times, and it also increases across all age groups. And one that we're seeing more often now is obstructive sleep apnea, people who stop breathing while they're sleeping. That is moderate to severe and untreated, increases your risk 3 to 4 times. And this is something that a risk factor that is very easy to take care of. How to recognize a stroke. An algorithm we use here at the hospital and in the community is called the B-FAST. The B stands for balance. So if you're having loss of balance, a sudden, severe headache that you don't generally have, or dizziness that makes the room spin, those are usually accompanied by some other symptom, but they are a sign of a stroke. Eyes, blurry vision, even a visual field loss where you can't see, say, to the outside of one side of your eye, is a symptom. Your face, you will see facial drooping. The facial drooping is generally just of the mouth, not the entire face. There's something called Bell's palsy that includes the eye, and that can sometimes be mistaken for a stroke, but our motto here is we would rather over alert and over identify if someone's having a stroke, such as in that Bell's palsy. We would rather check it out, do a CAT scan, rather than say, oh, well, we don't really think it's this. Generally, when you see the eye involved, it's not, but in Bell's palsy, it's not always obvious on some patients, so we err on the side of caution. A stands for arm, but that can be arm or leg weakness. In strokes, that is unilateral or one-sided. So when you have a stroke, a part of your brain that is affected, say the left side of your brain is affected, your symptoms will be on the right side of your body. So you will have just unilateral or one-sided weakness, and it can vary from being very mild to extreme to where you can't even move that arm or leg. Speech difficulties, again, they vary as well. They can be just as simple as someone is having trouble getting the words out that they want to say. You can see them, you can really physically see them struggling to express those words, to the speech being garbled and not making sense. And then the T stands for time, which, as I talked about earlier, time is of the essence. Call 911 as soon as the symptoms start. And the reason we tell you to call 911, not only just because we don't want you getting in an accident, but they can alert us at the hospital that they've got someone that they think is having a stroke coming in, and we will be ready to go right straight to CAT scan when you get here. Some other symptoms that you might see with a stroke are numbness, especially on one side of the body. We do see that often. Confusion is also one of the symptoms we see along with the speech pattern. Sometimes both eyes will be affected when you're having trouble seeing. Your gait, as we talked about, balance, but also walking. When we sometimes will have the patient try to get up and walk, and they cannot. Their sense of coordination is off. And then that sudden, like I mentioned, sudden severe headache that has no known cause. You don't have a history of migraines. You don't really have a history of headaches. Those can be indicative of a stroke. This is just a little, when I go out, when we could go out, when I do go out in the community, this is something I would hand out to people to kind of gauge if they're at high risk or low risk for having a stroke, and it goes through a lot of the risk factors. Stroke prevention. So, as I mentioned earlier, high blood pressure is the #1 risk factor for stroke, and it is something that we can prevent. So, what is your blood pressure? Well, when your heart is beating, it pumps blood into your blood vessels and creates a pressure against the walls of those blood vessels. That pressure is what allows the blood to pump to all parts of your body. And the blood pressure gives us two readings, a top number, or what's called systolic, and a smaller number, or the lower number, called the diastolic. The guidelines for blood pressure changed recently, and now elevated blood pressure is like 120 to 129, the systolic, the high number, and less than 80 on the lower number. People with elevated blood pressure are likely to go on and then develop high blood pressure unless steps are taken to control that. High blood pressure stage 1 is when the top number is 130 to 139, or the lower number 80 to 89. At this stage, your doctor is likely to recommend some lifestyle changes and may consider adding blood pressure medication based on your other risk factors. And then at stage 2, it is considered 140 or higher on the top number and 90 or higher on the lower number. At that stage, your doctor is going to prescribe blood pressure medicines, and probably a combination of blood pressure medicines. And the last one we do see often in our emergency department, when you're in a hypertensive crisis, when the blood pressure is higher than 180 over 120. You need to contact your physician immediately, and he may send you to the ER. In addition, if you're experiencing any other symptoms along with your high blood pressure, if you're having chest pain, shortness of air, back pain, any of the symptoms of numbness, weakness, visual difficulties, speaking, call 911 and get yourself to the hospital. Nearly half of Americans do have high blood pressure, and as we've talked about 50% of them do not know it. For a good diagnosis of high blood pressure, it's important to use an average based on 2 or more readings obtained at different occasions. You can get home blood pressure kits, or you can go to the local pharmacies and have your blood pressure checked there. So why does having this high blood pressure, why is it so important? Well, it adds a additional workload to almost every part of your body, your brain, your eyes, your heart, your kidneys. It can also affect sexual function in certain patients. And as I've already said, it is treatable, and it is important to get it early and to keep it under control, because typically our blood pressure rises anyway with age due to our arteries just become stiffer. There's that plaque buildup that I kind of talked about. And as we age, we have more incident of having some other risk factors, such as the heart disease, along with the high blood pressure, which coupled together makes us at higher risk for having a stroke. These are some of the ways, and I'm not going to talk too much about them right now because I've got them in later slides, but how to live healthy and prevent a stroke is to control your blood pressure, eat healthy, get enough sleep. I know many of us do not. Have some sort of physical activity. If you have a high BMI, lose weight, stop smoking, diabetes, control your blood sugar, and manage your cholesterol. So knowing your blood pressure is important. I have on here to have it checked at least annually by your physician, but if you have known high blood pressure, often they will want to have it checked more frequently. Atrial fibrillation, spoke about a little bit earlier, does increase your risk. Atrial fibrillation is a certain type of irregular heartbeat that you may or may not be aware. Some people feel it, other people do not feel it. But if you know that you have it, work with your doctor to manage it. And if you smoke, just stop. I have literally nothing more than that. It's so bad for you. Stop. It affects every organ of your body. I know that's easier said than done, but I can't emphasize that enough. This is just an example of a blood pressure log that I often hand out to patients. And we're going to go through a little bit of checking your blood pressure and how that looks. So self-monitoring, as I said, you can get cuffs off of many websites or at pharmacies, and make sure that you get one that fits you well. Here are some steps that are good for getting an accurate blood pressure measurement. Don't smoke, drink, or any caffeine or alcohol, or exercise within 30 minutes, because believe it or not, exercise does raise your blood pressure. So do it first thing in the morning is the best thing to do to check your blood pressure. Make sure you're resting in a chair, comfortably relaxed. Take a couple of readings, 1 minute apart. Make sure that you're using, like I said, a cuff that fits you, because if it's too large or too small, you're gonna get inaccurate readings. And the cuff goes right above the bend of your elbow, and you can put it on either arm. It doesn't matter which arm you use. And by monitoring your blood pressure and working with your physician to lower your blood pressure, here are some of the benefits that you will reap. You decrease your risk of heart disease by 17%, your risk of stroke by 27%, and your risk of heart failure by 28%. If you do drink alcohol, that's fine. Just do so in moderation, which moderation is considered 2 glasses of wine a night. So just do it in moderation. Know your cholesterol numbers. Like high cholesterol impacts the blood flow and oxygenation to the blood. So if your cholesterol is high, work with your physician to control it. And if you're diabetic, like I said, if it's left untreated, it can cause just numerous health complications. So again, work with keeping your blood glucose under control and following your doctor's recommendations. A few things that will raise your blood pressure. We've really kind of touched on them when I talked about checking your blood pressure is alcohol, drugs, and caffeine. Certain drugs, such as cancer medications, some of the medications that patients have to take for mental health, antidepressants can raise your blood pressure. So if you have any concerns about your medications, talk with your either your pharmacist or one of your healthcare providers about whether your medications may be causing your high blood pressure. More about prevention: include exercise in your daily routine. Exercise gets your blood pumping, and it helps to increase that supply of oxygen and blood flow to the brain. My version of exercise is that any exercise is better than none. If you like, I am sedentary. I sit at a desk big part of the day. If I have my watch set to go off hourly, so I get up and do walk around the perimeter of the hospital to get some exercise and just get that blood flowing better. And anything that you can do will help improve your lifestyle. Watch your diet. Many times you need a low sodium, low fat diet, especially if you have high blood pressure on the sodium. You're going to want to follow a low sodium diet for that. If you have any circulation problems, work with your doctor on that. And last but not least, if you're experiencing any of the symptoms I've mentioned, call 911. We lose millions of neurons in our brain every minute if you're having a stroke. Discuss your blood pressure with your physician and let him know if you're having any barriers to following his guidelines, such as the low sodium diet, any medications that you feel may be causing you issues. If you're having difficulty trying to find some exercise that works for you, like I said, for me, I think walking is just great. And it doesn't have to be that you're walking super fast. Just to add a pace that is maybe just a little bit faster than what you normally work at is going to get that blood flowing. If you're under an undue amount of stress, talk to your physician about that. They are there to listen to you, and they can help you with that. Medication. So always bring a list of your medications, the dosage, and how often frequently you take it with you when you go see the physician. Always, always, always take your medication as prescribed. They only work if you take them regularly. Some of the medications can have adverse effects if you stop them abruptly. So do not stop taking any of your medications without consulting a physician. An easy thing for me to remember is to take my medicine at the same time every day. So that I take all my meds at bedtime. I have to take cholesterol medication. So I take it at bedtime. That's very easy for me to remember. I do it before I go to bed. If you need an additional reminder, use a calendar on your smartphones or a pill box as a reminder, and anything that will help you to remember to take them regularly. So in conclusion, small changes can have a huge impact on your stroke risk factors. Like, I cannot emphasize enough to not smoke, eat heart healthy, maintain a healthy weight, and get regular physical activity. And then with doing that, you're gonna see some effects on your weight. Limit your sodium intake, your alcohol intake, and taking your medicines as prescribed. Thank you for joining us today. Are there any questions?
Thank you, Brenda. So if you have any questions, please go ahead and enter those in the Q&A or the chat. Brenda, I have a question for you while we're waiting.
Okay.
Is there one type of stroke that is more, the mortality rate is higher than the other?
That's a good question. That is difficult to say because of the two different types of strokes. The ischemic strokes really depends on the severity of the stroke, the location of the stroke, where the blood clot is, if we're able to go in and retrieve that blood clot or not. Sometimes they are too distal for us to retrieve. And so I think if I had to say, hemorrhagic strokes are often more so than the ischemic. By their nature, patients either present with very mild symptoms or they present extremely, once that aneurysm ruptures, they're unresponsive a lot of times very quickly. And if we cannot get to them quick enough, then that is a higher mortality.
Okay. Okay, do we have any more questions? Well, Brenda, that was a ton of information. Thank you so much. I cannot wait to get this on YouTube so that you guys can share it and watch it again. If you have any questions that you come up with, please go ahead and reach out to me and I can get you some answers. So with that, I will bid you good day. Brenda, thank you so much for talking with us.
Thank you, Shanna.
Bye.
Bye.